Okay, we're going to use the Kendrick Optimum traction device for mid-shaft femurs. We use this for a mid-shaft femur, also the upper 2/3 of the tib and fib as well can be used. Okay, so what we want to try to do is this patient sustained a mid-shaft fracture. We want to try to reduce the bones and put them back into alignment so that they're not sticking into the muscle and causing a lot of pain and aggravation, or potentially further blood loss by severing nerves and veins. Okay, traction splint's fairly straightforward. Comes in a little orange casing like this. So we take all the various components out of it. Okay, I'll deal with that a little bit later. Okay, the first thing we do is we explain the procedure to the patient. Perhaps we've inserted an IV as well. Perhaps we've given some pain relief for the fracture. What we're going to do is it's actually essentially a two-person technique. So while we're assuming that somebody is going to apply traction to the leg, so we're going to apply traction, so we're going to pull the leg like that. And so in this scenario, we're assuming somebody's applied traction and is maintaining traction. Okay, we have an ankle splint and we also have a boot splint as well. However, we prefer the ankle splint because that way we can keep, if there's any boots and things on, we prefer to take them off because we can get a good view of the distal circulation of the foot. Okay, the first thing we do is we apply the ankle strap. So the ankle strap goes over like that. Okay, we tighten the ankle strap around like that, and we put this part under here, and we just ensure that we have a longer yellow part that's going to go on the bottom of our traction splint and a shorter red part, and we're going to use this green part here to tighten that around the feet. Like that. Okay, so we're going to make sure that's nice and firm. With that, we've got a short red, which we're going to pull later to apply traction, and this yellow bit goes on the end of the splint. All right, the next thing we're going to do is apply our ischial strap, for want of a better word. That's going to go top part of the leg, so we put the leg in, leave a leg there, so it's go underneath like that. Okay, and we jockey that up as far as it'll go, and ensure that we're not impinging on their private areas, and strap that tight as far up as it'll go, right up here, right up to the pelvis. Okay, and we make sure that this part here that's going to receive the traction component is on the lateral side of the leg, like that. Okay, and then we pull that as tight as comfort allows. Okay, so these are the first two steps. Then we take out our traction splint components, we put them together, just like that. Okay. Now we know we've got a gold pieces and we've got a dark piece. We align that with the leg, and what we want to do is to align the end of the black part to the heel of the foot. So this part here projects away from the foot because we're going to apply traction in that direction. Okay, so we measure it up, we make sure that we've got plenty of black component past the leg there. We measure this up and we can see that we're going to need to take out one rod. Okay, one rod, and then that's approximately the right size, and insert these two components in. Can you see that, Helen? Is that going in there? See those two components going in there? Okay. We then attach this orange knee strap. Okay, make sure that's tight. Knee strap to the leg, so now that's holding the traction splint to the leg. The next thing we do is that we apply the yellow component by pulling on this red strap here. We apply the yellow component towards the end of the traction splint, like such. okay. And again, we're assuming that somebody's got applying traction to the leg, and then we can now pull the red part, assuming it's not jammed. Okay, pull that red part, okay, until we achieve approximately the same length as the other leg. And we've got good firm traction. Okay, we've applied that. Okay. Next step now is to secure the traction splint, and we have a red and a green strap. It follows the traffic light principle, so we go red, orange and green. Okay, and this is the thigh strap. So we put the thigh strap under. Goes over the top like that, and we secure the thigh strap, and the same with the green. Green strap lower down towards the ankle. So we have our colour coding: red, yellow, green. Okay, so that's the attachment of the traction splint. We now check for distal perfusion, so we make sure that there's good blood flow going to the distal part of the limb, and it's not going blue, and also feel for sensation. Can you feel that? Okay, so he's got good nervous connection there as well. What I also like to tend to do, which is not done very often in all the videos, is that when I have a mid-shaft femur, I like to circumferentially bandage the femur first before I put traction splint on. The reason is you're still going to get bleeding in there, and the leg can swell up quite a lot. And it still leaves a lot of room for blood loss. So my preference is to apply a firm circumferential bandage around the whole top part of the leg, the upper part of the leg, and then apply the traction splint. So that's just the only variation that I would contribute to. Okay, thank you.